Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Shaer, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I'm pleased to welcome Dr. Brittany Busse, who started off as a surgeon and is now a champion for independent physician practices and equitable care as the co-founder of a company called ViTel Health. Brittany, thank you so much for joining me today.
Yeah, thanks for having me, Jen. I'm really excited to speak with you and talk more about my story and the role ViTel Health can play in physician wellness.
Terrific. All right. So before we get into, because you are doing some really terrific stuff today, but before we do that, I was hoping that we could go back to a little bit. First, I want to thank you for reaching out to me and being willing to share some of your background, because I know that sometimes can be a little challenging. So why don't you tell us first, why you became a doctor and then sort of about your early journey?
Sure. I know telling your story for the first time is often really challenging because there's so many emotions tied to that, and it can be really frightening for a lot of people to be vulnerable, especially for physicians. So I really appreciate creating a safe space for physicians and being able to share my story in the hopes that someone hears something that resonates for them as well, because we think our stories are so individual, but the specific is really the universal, and that we've all been there or had similar aspects in our story. So I'm, always open to share in the hopes that it helps someone else. So I don't have any other physicians in my family. My mom's a nurse, and when I was younger, I was really attracted to the thought of helping people and really interested in the medical profession. My mom had lots of old nursing books lying around, and she just really pushed me academically, wanted me to become a physician. She felt like she would have if she were quote unquote smart enough. She probably was smart enough, capable enough, but didn't necessarily get pushed in that direction. And so, like, not to disparage nurses, if there's any nurses listening here, like, I don't think doctors are smarter than you.
For sure.
That was my mom's view, was that her daughter is exceptionally smart and should become a doctor. And so I thought about the different pathways that I could take. And my mom was actually a behavioral health nurse. So she had a lot of cool psych books lying around, and I just loved psychology. I majored in physiology and psychology at Michigan State University. I actually wanted to pursue a career in psychiatry and addiction medicine. I was really fascinated by neurology and the effects that drugs have on the brain. Um, but when I went into medical school, I started doing my rotations, my early clinical rotations. I realized that a lot of it was just prescribing. So whether it was psychiatry or general practice, there was just a lot of prescribing going on, and the way that corporate medicine was practiced, there wasn't a lot of time for patients. So I was seeing like patient after patient after patient with my preceptor as the medical student, getting a lot of information, but not really having that deep personal connection that I wanted to have, especially when it came to mental illness and psychiatry.
And that was your experience even during medical school.
Yeah, and so I was a medical
That's
student.
so
I graduated
interesting.
in 2009. So from 2005 to 2009 would be my personal experience with
Right.
doctoring
Because
and
usually, right, if they're ever going to have time to spend with the patient,
Mhm.
it's usually during medical school where they really
Yeah.
like have you dive in.
A
Okay.
little bit more, I would say, like in the hospital, I could go and sit at a patient's bedside and I would have really cool conversations with patients. But I guess I was very aware as a medical student as far as like watching the residents around me
Mhm.
and watching the attending physicians and trying to figure out like what would my life look like
Sure. That makes
if I
sense.
do that. And I think so many times we get stuck in that, what when I'm an attending, this will be it and it will be better scenario. But my thought was always, what if I'm an attending and I'm stuck doing this for the rest of my life? Would I be happy?
Right.
And I just kept finding that the answer was no a lot of the time. And I initially had written off surgery because blood makes me queasy, and I would pass out. I passed out on an ER rotation one time just because like a kid was getting stitches. And I thought, oh my gosh, I'm never going to be able to do this. But the first surgery I saw, I'd actually been avoiding surgery like the whole first week of the rotation. And I just followed the intern around all day so that I could avoid going to the OR because the
Wait,
intern
did you
never
realize
knows.
you were afraid of blood before
Oh
you went
yeah.
to medical school?
Yeah, I
Yeah,
did. That's why another reason to go into psychiatry, right? Like no
right,
one ever bleeds in the psychiatrist office, at least hopefully not. I
right.
can't say no one, but um, so the intern got called to a surgery because they had too many surgeons operating and not enough residents. And she's, come on, we're going. This is so exciting. And I was like
Oh,
petrified.
right.
I did not want to be in the OR. That was the last place I wanted to be. And we got called to this little minor hernia operation and we scrubbed in. And I'm just standing there terrified about like, am I going to pass out? What's going to happen? They had a chair ready because I told them I was like a faint risk. And I start the procedure. And what I found was that with the drapes and the way that the patient is sectioned off, and you have this very small, clean
Right.
square where you focus all of your attention, and there's some organs in the square or whatever the problem is, but there's no patient in the room, right? Like
Sure.
and there isn't. So you're almost like separating the procedure from the patient in that way. And somehow that helped my brain wrap around the fact that the bleeding, which was, well controlled during operation, you're trying not to minimize blood loss and all of those good things. But the bleeding wasn't necessarily a person, and there was no crying, there was no pain involved. And
Right.
like mentally that really worked for me because there was the problem, which was the hernia. Then we fixed the problem. The patient went home and they never heard from that person again. I was like, oh, I could do that. That is something I
Very,
could do. That's
very
like,
rewarding, right? A
yeah,
problem
at
you
the end of the
fixed it.
day, how many problems did I solve? Like a whole bunch of them. And they went home and they did great. And so I thought that was probably the best route for me at that time, right? Like the person who I was at that time just didn't need to be in these like long-term relationships where people just were suffering and weren't getting better, in my opinion. And like that's
Right.
what I saw. And I think that does affect a lot of doctors, in primary care, is that you see this ongoing suffering and you only have these 15 minutes and all you end up doing is refilling prescriptions and telling them like, I'll see you in 6 months or I'll see you in 12 months. And like you're leaving on like a hope and a prayer that the person actually listened to you. Maybe they're going to be a little bit better, but you just don't have time for the things that were important to me, like nutrition and exercise and like spirituality and all of those things that I think are key to helping patients recover their health, not just prolong their state of injury and hopefully keep them out of the hospital. So it was really a conundrum for me as a medical student trying to figure out how could I be a doctor and still be authentic to myself.
Yeah, so many of us as doctors, or PAs or NPs or nurses, we want to fix things. We want to help people get better. And you're right. I think that's really largely the struggle with being a doctor in general, is we can't always fix things. Sometimes just being there and being present is the treatment.
Yeah.
But surgery, definitely, I felt that way. I really enjoyed surgery and like orthopedics, but it was a little too, for me, it was seeing a broken bone. I don't know, seeing an arm that's bending in the wrong spot. It just, I could, like, for you, it was blood.
Yeah.
For me, it was that.
Yeah, for sure. That's always the thing that gets you when you're a doctor. For me, it was I walked into a patient's room who was getting dialysis one time and like immediately hit the floor.
Oh God.
I was like, wow, their blood is going out of their body into a machine and coming back into them.
All right. So for all the people out there who are afraid of blood and thought they couldn't be doctors, there is hope for you. All right. So go on with your story. So you went into surgery.
Yeah, so I ended up actually wanting to match into plastics. I really loved aesthetics and helping people kind of like feel better, look better, but especially helping women recover from breast cancer. And I just felt really strongly called to help with reconstructive surgery post a mastectomy. So I started my journey towards that, but I was kind of late to the game when it comes to plastic surgery. It's just extremely competitive residency. You have to have all of your background in that and research that you've done as a student and even leading up to being a student. And so I had done most of my work in psychology and psychiatry and was kind of an odd fit for a plastics residency. And there's about 100 spots in the country when I applied, and they had, I think, close to 900 applicants that year.
Hmm.
Not super good odds.
Right.
And 8 of those applicants were from my school. So it was very, very competitive. I ended up going unmatched and matching into a preliminary spot in a general surgery program. So as a preliminary resident who scrambled into that spot, I always had this feeling of like I didn't really fit in. They
Mhm.
didn't choose me. Like I kind of just fell into their lap when they still needed somebody. And my contracts were always year to year. There was no guarantee that they were going to have me back.
Mm.
And I always just felt like no matter how hard I tried, no matter how good my scores were, every year my scores were the top 99th percentile and everything. And it didn't really seem to matter to them like how good I was. They just didn't like my way of being, my attitude, and my necessity that I always had to like protect myself and to set boundaries and to make sure that I had a life outside of my career in medicine, which, doesn't really go well with residency and the whole
No, for
hierarchical
sure.
system that we had there. And my program was especially bad because they were associated with a military operation as well. And so there was a real hierarchy there, and they didn't like push back, and they didn't understand why anyone would say no in that situation.
So did
So
you enjoy the actual work? The
oh yeah,
actual
I loved doing the work. I loved taking care of patients. I was very present, very dedicated, very devoted to patient care and to outcomes and to being the best surgeon I could be. But what I wasn't devoted to was like interminable work hours,
yeah.
right? Like you need to know when you're off duty, in my opinion. Like you need to have that time with your family, with the people who are important to you, because at the end of the day, if something happens to your medical career, like it did for mine, you will have no one left to help you. And support was critical for me. So during my 4th year, I was diagnosed with bilateral retinal detachment. And I ended up going into pretty much emergency surgery. It's a long story, but basically I would have dry eye. I had somebody look at my dry eye, and they looked at my retinas during the exam and found that they were detaching. So it had nothing to do. I had no symptoms, nothing. I was 29 years old.
Wow.
And even the surgeon who did the operation, who was probably in his 70s and chair of the retinal surgery department at a large academic institution, told me he'd never seen it before, like bilateral retinal detachment in a 29-year-old.
Oh, well,
With no
lucky you.
cause.
Gosh.
Yeah. I was like, yay, lucky me. He's like, you could be blind. And I'm like, thank you. You're a medical anomaly.
Wow.
So after that process, I was left with some difficulties with my vision in my right eye, difficulty focusing, really like microscopic was out of the question for me. And that had kind of been my path, was microscopic deep flap reconstructions for women with breast
Right.
cancer. And I was kind of just like stuck, and worse than that, my program was like, yeah, basically you either come back to work, quit, or be fired.
Wow.
And I said, but I'm not done recovering yet. I'm like, yeah, I don't care. And
Wow.
I just kind of had to look around at that point and say, like, they've never made my life easy. I don't feel like I fit in here. There has to be something better for me out there. I don't know what it is yet, but I'm going to have to figure it out. And I said, oh, it's fine. I guess I'll quit, and
God.
see what else I can find out there for my skill set and for my passions. And, it's taken me about 10 years at that point, but I feel like I am finally where I belong.
So let me ask you a question. Before you had that horrible, retinal detachment emergency, were you pushing back on things that were unreasonable? Like, what's an example of something? Like, would a normal person
Yeah.
think you were being unreasonable?
Oh, a normal person would not. I think most of my friends who weren't in medicine were like, they want you to do what? I think some of the things I received a lot of pushback for were, number one being like, well, the intern is on call. I am not on call. I'm the third year. I'm not going to stay until you're done with your operations at midnight, just to make sure that all the patients are signed out to you. Like, I signed my patients out to the intern. It's 5 o'clock or 6 o'clock in the evening. I've been here since 4 a.m. Like,
Yeah, got
I'd
it.
like to go home because, yeah, when you're not on call and you have to be back at the hospital the next day, they
Right.
say 100 hours, I think, or 80 hours was like the max for residents.
Mm-hmm.
And that was in hospital time. That did not include time on call, time driving back and forth to the hospital when you were called. There were a lot of times I was there for 48 hours or more
Mm-hmm.
as a third year resident, because I would be just leaving and I would get in my car in the parking lot and be called back to a surgery or to an issue that was happening. So it's not unreasonable at all to think that somebody deserves a little bit of time away
Right.
from work or at
Yeah.
home,
The other
especially when that
residents,
person's only paid $30,000 a year.
yeah, well, with the money, that's a whole other
Yeah.
piece. But so, all right, so you had this retinal detachment, which, oh my God, so scary. Thank goodness. Who goes to the eye doctor? You just happen to go to the eye doctor?
I had some irritation from a corneal abrasion. And I
Oh
just
my
wanted some
God.
drops, and no one would give them to me without an exam. They were like, no, you're going to have an exam first. And I was like,
You were so lucky. Look at that.
mhm. Yeah, my primary care doctor told me she would not prescribe the drops that I wanted because I had messenger through my chart, and said, I have these drops, but I ran out and I need them to help with my corneal abrasion. And she goes, I
Yeah.
don't know. That's not something I normally prescribe. You should probably have an exam. And if it weren't for her telling me that I had to go have an exam, like, I probably would have been blind.
Wow. So you say you made the decision to quit, but
Mhm.
you say it very sort of like it was an easy decision, but I'm
Yeah.
guessing at the time it probably wasn't as easy. You're probably saying that with hindsight,
Yeah.
right? I mean,
I
what
would
sort
say
of,
that it was both easy and not easy, right? Like, when someone's gone out of their way to make your life miserable. I mean, the things I was dealing with my program was like sexual harassment and
oh,
abuse. I said it was worse than people not liking me. There was gossiping that was going on. Things that were said to my face, things that were said behind my back. My life
yeah.
was not good, right? Like, and I was dealing with
Mhm.
physical issues as well, just from lack of sleep and lack of adequate nutrition, and um so many things that were going on that I just, at that point, I was kind of just over it with them,
Yeah.
like, it was like you're climbing up one of those walls with the rope attached to it, and it's got the slats of wood.
Yeah.
Every time you get close to the top, someone adds another slat.
Hmm.
They're just like, oh, sorry, nope, not good enough. And it was
Yeah.
like, this time, instead of just one, they just piled on 20. And I was like, and then there was a little voice behind me going, you can climb down off the wall now if you want.
And that was your freedom.
Yeah.
It's,
Yeah, I think that's a good idea, right? Like, I spent so long denying that inner voice, that feeling. Like, I knew that all of this was wrong. I knew I was in pain. Like, I knew I wanted to cry all
yeah.
the time. A couple of times in the surgeries, I did cry and like
Oh,
had the attending yell at me because like they were yelling at me, and then I cried, and then they yelled at me some more for crying. Like, it just wasn't a healthy
yeah.
situation
Do
for
you
anyone.
think, Brittany, do you think that if you didn't have the retinal detachments that you would be a surgeon today?
I can't really say. I don't know. My life only goes one way.
Yeah. Yeah.
I think
So,
mom wishes that I had stayed the path and been a
yeah.
surgeon.
Interesting. Yeah.
But there's so many things, and my true calling in life has always been to help people in the greater good.
Hmm.
And I don't know that I ever would have felt fulfilled
Yeah.
in that role.
So now we
Having
can get
in
to what you're
surgery and
doing
just getting
now.
through what I do every day, right? Like,
Yeah.
to me, it would have been getting through the day. Like, I did this many surgeries. Oh, these patients were grateful, great, and you were done.
Yeah. I'm not a big believer in, well, I sort of believe in things happen for a reason, but I
Mhm.
don't necessarily frame it that way. I like to frame it more as things happen and you get to create the reason,
Yeah.
right?
Yeah, exactly.
And you certainly now on the other side of this tragedy of this situation you were dealt have sort of recreated. You didn't really stay stuck very long. You took it. Did you get stuck? I mean, I guess I shouldn't put words in your mouth. You made the decision, and then how quickly, like, did you get depressed? Did you sit with it for a while, or did you right
Oh,
away?
I right away started looking for jobs, but
Yeah.
the issue is that board certification is a requirement for employment for most hospital jobs. Like it's not enough to be a doctor. Everyone wants to know what kind of doctor you are. So like that became a very touchy question for me. Like even just lay people asking me like, oh, what kind of doctor? It was like
Right.
super sensitive because I saw myself as this lesser doctor who couldn't tell you what kind of doctor I am. So it's, oh, I'm a generalist, or whatever I would say, just to get past the niceties of the question, because most people
Right.
don't really understand anyway. But I worked at urgent care. I found a job pretty quickly in that capacity and just worked. Again, it was just getting through the day. Like I needed a paycheck. I needed health insurance most of all at that point.
Sure.
I needed the benefits. And then, because not only me, but my partner and his children were on my health benefits at the hospital. So we had to quickly replace that. And there wasn't a lot of time for like thought or introspection. And I would say at that point in my life, I probably wasn't capable of that in that respect. Like I had started doing yoga as part of my recovery for my eyes, because I found that balancing kind of helped me align my vision.
Interesting.
And it was interesting because like the more I practiced and the more I, learned yoga principles, I actually took a teacher training so that I could really dive into the principles more. I found that it helped align my external vision as well. Like I have a better understanding of myself and how I move through the world and making those decisions from that rooted place that's very instinctual for me. So it's like I know that I've always just been a move forward kind of person, but having that reliance on that inner compass, like I know what my authentic guide points are. I know what my North Star is. So it becomes easier for me to make a decision and move quickly towards that decision, where other people might say like, wow, that was impulsive, like, well, it's not impulsive, it's intuitive. And I have that good, groundwork that's been laid with my intuition, where when I listen to it, things happen well. And even if like sometimes they turn out a little bit less well, like I always am able to learn and then move again in the direction of that compass. So always just readjusting, reevaluating, and pivoting.
I couldn't agree more how important it is to really know where that true north though is, so that you can tell when you're off course.
Yeah,
for
I
sure.
think we all have that feeling, right? Like we just don't always listen to it, especially if you don't have like a history with it. Like just like any muscle that you work, like I wouldn't try to like hang from a bar over a cliff if I didn't trust my arm and shoulder muscles to like hold on to it, right? I guess. And if you don't know that your intuition is following the right guide points, you haven't exercised it, you haven't practiced utilizing it, you don't have a result to fall back on, then it is going to be really scary the first time you try to exercise it. So I do recommend small doses of following your gut daily.
I always like to liken it especially for doctors to symptoms like, when a patient has a fever, you try to figure out the underlying cause before you give them Tylenol. The same for you as a doctor. If you're feeling dread or anxious, or it's usually coming from something that is some misalignment, and it deserves a differential diagnosis before you just either blunt it by Netflixing for 6 hours or avoiding it completely. And it can help you definitely live more of a life of intention. So tell us where your path then went. You obviously did not resonate too much with urgent care. So where'd you go from there?
Yeah, and I think the problem with urgent care is a problem with a lot of employed positions, right? Is that you do a lot of work for somebody else, and they don't necessarily take your input or value system into their thought process. It's like, I don't know, I'm trying to put it that way, but, so even the small things, like if I'm having issues with the manager of the clinic who's managing the medical assistants, and I'm there 4 days a week, 12-hour shifts, so that's 48 hours. And the majority of the, clinicians working there, and I'm having an issue with somebody and they don't take my feedback at all, like that this person's an issue, that there's something going on here. And I'm like, well, whatever. Like, we don't care that this person is giving you problems. It's like, okay, if your management doesn't care that a worker, an employee who's below you is interfering with your ability to do patient care,
Right.
like, then you shouldn't work for that employer anymore. Like, it's just hands down wrong for them to let like a medical assistant or receptionist or anybody tell you what to do as the person providing patient care.
Yes.
You're doing something crazy and harmful to people, and they're trying to, whistleblow on you. But if you're doing a great job, you're there all the time, you're present, patients love you, your feedback should matter when it comes to how the clinic is run. And so
it's funny you bring that up. I literally was just talking about this last weekend. I was speaking about at the AAP conference about creating a culture that is supportive. And I specifically said, if you're the one who does the hiring and firing, that you should intervene when necessary. But if you're not, and you don't have that power, that you should raise your concerns. And if they don't acknowledge you, that you should, as they say, vote with your feet. There are so many places that could, that deserve your talents.
I said, you guys don't care about what I have to say. People literally call this urgent care asking if I'm working. You don't care what I have to say about how this place is run. Like, I can find a job somewhere else. And it's valuing myself enough. Like I said, even with that nagging feeling that I wasn't good enough because I didn't have that board certification, I knew I could find a job somewhere else. Even another urgent care would take me. So it's not that I had nowhere to go and I was valueless. Like, I determined the value of me. And like, that value is inherent. It's one value. I am one Brittany value unit. It doesn't matter if I, get more degrees or anything. It doesn't increase. I don't become 2. I don't become half. Like, I always am one value unit. And so for me, I started thinking about telehealth, because I was like, well, I could work from home. That sounds kind of fun. Like, if I don't have anything else to do, I could like practice yoga. I could do whatever I want to do within my own home. And I love the idea. Or I could do it from another state or another country even. And I was single at the time. I loved the idea of traveling. So it was a good fit. The problem I found was that you couldn't support yourself on a telehealth career per se, because you had to carry malpractice insurance. You had to carry all your licensing costs. The different platforms had very few patients. And they were trying to cobble together this whole career with, from here, from there, pulling all of these different places, and it just wasn't tenable. And so I found a job as a medical director and started exploring how telehealth was administered, creating processes for companies, really getting that respect component where my feedback really was valued because I was one of the first people doing it. And they would say, how do you think this should be done? Like, based on your experience as a doctor, like, and in taking care of patients who have a work-related injury, like, what would be the best process for us to utilize if this were all done remotely? And so you get to really think outside the box, like, if I cared for a patient remotely, like, where would the touch points be in other areas? And designing all the process around that. But at the end of the day, again, still being an employee, still having no ownership, no say. So when, money starts being an issue with a startup company, they decide who gets paid and who doesn't get paid. And the doctors, for some reason, stopped getting paid. And I looked around and said, you guys wouldn't have a company if it weren't for the doctors. And then the doctors kept working. And I was like, hey, stop working. Well, if we don't see the patients, who will? And I was like, but they haven't paid you for 2 months. And they're like, yeah, well, they will. And I couldn't believe that the doctors would allow themselves to not be paid.
Well, because we're such a perfect storm, because we are people pleasers and we want to care for patients, and we're working a system that just is all too happy to take advantage of our kindness and our
Exactly.
goodness, but the
And
patient,
that's what I saw.
Yeah.
I was like, that's not okay. It's not okay for companies to take advantage of our good nature and our willingness to help. And
Yeah.
it wasn't just in telehealth, right? It was across the board. Like, we just wanted to help patients, and we would do anything in our power to say yes, to do the right thing, and just to represent the best aspects of humanity. In most cases of doctors, like, are there a few bad apples? Sure. But the majority of doctors are great human beings who just want to take care of patients. So I
Yep.
started writing down things in my notebook, like, what does a doctor need if they want to start a clinic or a healthcare practice of their own? Like, and how could we make that more affordable? Right? Because the whole thing was like, if you're a doctor and let's say you just can't take anymore, you have to quit, and you only have so much money in your bank account, and that's going to last you like 6 months of living expenses, like say if you were frugal, or 3 months if you weren't.
Mhm.
And that was a situation I was in, right? Like, I had to quit my job and I had no money. Or at one point I broke up with my boyfriend. He threw me out of the house
Oh
and I
God.
had no money. So I had to go find a place to live, put down deposits for an apartment, do all of the things, like, be resourceful. So what does a person do in that situation? It's like, okay, we could start a digital health practice. What if you were your own teledoc? Right? And you started attracting patients and they were paying you the subscriber fee every month. The patients would get better care because they'd have continuous contact with one doctor. You would be happy because you would decide how that care proceeds, whether that's able to be answered with a text message or a phone call, or if you need a visit, you need to actually look at what's going on with the patient. Like, you get to decide how that's done, not an insurance company, not an employer, not anybody else. And you get to rely on knowing that that's regular income for you. Like, you have this, 300, 500 patient base that subscribes to you as their doctor that you've developed a relationship with. And there's so much, like, gratitude that I have for the doctors who've already started doing this and showing that this is possible for other doctors to do as well, because I didn't know that this was actually a thing until I started researching it, like direct primary care, direct specialty care doctors. And I thought, well, that just makes so much sense, right? Because what are some of the problems with the healthcare system? Like, it's fragmented, there's no relationships, your time is seen as this commodity that is utilized by the corporations for their profit. Well, in this case, you're utilizing the time for your profits however you see fit. Care is no longer fragmented because all of it runs through you, and you can get the support you need. So you're not an island. Physicians are independent in our model, but not alone. So they
Yeah.
can rely on other physicians for support, for networking. We have an after hours nurse line that is supported by everyone. So that physicians aren't on call 24/7 for their practice. Like, everything that physicians need to feel safe in a practice, we either have it, or if we don't have it, I want to hear what you need and then I can add it,
Yeah.
and
But
always
Brittany, how do you
include.
handle the the freedom of that? It sounds
Mhm.
beautiful, but we always worry about taking, as doctors, like, we always worry about taking care of people who can't afford to participate in something that requires a subscription.
Yeah, and that's something that, like, I struggle with as well. So we treat a lot of Medicare patients through remote patient monitoring and chronic care management programs, and a lot of those patients are on, full medical subsidy, so they don't have a lot of income, or they have no extra income. Some of them are getting Meals on Wheels for their food.
Mhm.
A lot of benefits that they rely on, and no, they don't have $30 a month or $50 a month to pay a doctor to be their direct primary care doctor. The way that we're able to do that within our cooperative is that we can actually take on the billing for all of those individuals, saving the doctors from the administrative work of setting up the contracting and credentialing and taking in the billing and chasing down the revenue cycle management and finding the underpayments and all those crazy things that doctors have to
Mhm.
do in private practice if they want to take insurance. And we can take care of all that insurance stuff for you and make sure you just get paid what you deserve from the work that you did. So if your patients are enrolled, let's say in RPM CCM, that's a monthly
And
recurring
that
revenue.
is RPM, just
So
to
remote patient monitoring, vital sign monitoring, chronic care management, that's recurring revenue that gets paid every month by the insurance companies. If you're supporting that program, then you're also making per patient per month recurring revenue from those interactions. So you don't have to rely on office visits and E&M codes in order to
Mhm.
sustain your practice.
Yeah, this is more like a value
Mhm.
care instead and
It
not a
is, but it's not
cost.
quite a capitation, right? Like it's so my issue with value-based care is that patients have to be really sick a
Mhm.
lot of times for it to be worthwhile to the entities who manage these. So ACOs, they actually want physicians to be super sick or patients to be super sick because they make their money on keeping them out of the hospital and preventing them from using expensive services and procedures and stuff like that. The way that this model works is it's actually incentivized to help your patients meet their health goals and be healthier, and you can still get paid for that. So for things that you are inclined to naturally do, which is provide social support, emotional support, nutritional counseling, exercise counseling, we can do all that with our healthcare coaches who are under your guidance and meeting with patients on a weekly or bi-weekly basis. And those patients are feeling better, getting healthier. We have a patient told us he's like 78 years old. He said, I feel better than I did in my 50s, all because of like following the guidelines of his doctor that are supported on a regular basis by the healthcare coach. So none of this, like I see my patient, give them a script and, like I said, hope and a prayer that in 12 months they're not dead
Yeah,
or worse
I love
than
I
they were
love
the
the
last time I saw them. So this is all
team-based
about
care approach.
team-based care.
Yeah.
Make sure that you as the doctor are practicing at the top of your license. You are giving the recommendations, you're giving the overview, but the people with the boots on the ground doing the day-to-day work of coaching the patient, of supporting the patient, those can be healthcare coaches and people who don't require MDs.
Yeah. Yeah. We're trying to do that at my office as well, get health coaches involved. And it's a lot to do. Let me ask you one more question before we go, because I know you have a hard stop and we've been talking for a while. I love your hard stop, which is lunch with your son, right? You
That's
never
really
don't want to
sad.
miss
Like I said,
that.
I've
Um,
always been a difficult person, right? When it comes to boundaries and family is
no, it's
my number
good.
one
It's good.
boundary.
But because you've been on this long journey and you're now doing something um, not direct patient care yourself. Do you miss that?
I think part of me does. I mean, as a doctor, we love those day-to-day interactions that we have with most of our patients.
Mhm. Yes.
And I would love the positive feedback I would get from patients, and just the appreciation that so many of them have for what we do. I would say that I still get that in the appreciation that the doctors have for what we do, because this is a model that no one is really that familiar with. Like
Mhm.
it's fewer and far between that we know other doctors who have private practices,
Yeah.
and if they do, they're struggling and they're about to sell to someone
Mhm.
just so that they don't have to worry about the overhead and all of these costs anymore. And we don't see doctors thriving anymore, whether that's in private practice or in employed care. Like it's extremely rare for me to meet a physician who says like, I love my job. And that's weird to me. When I was a kid, physicians, as far as I could tell, loved their job. My pediatrician loved his job. My mom's an internal medicine doctor seemed to love his job. They were happy, they were fulfilled, they were spending time with their patients, they were golfing,
Yeah.
like
Yes.
they loved life, and it was good to be a doctor. People wanted to become doctors. Now nobody wants to be a doctor, and nobody especially wants to practice primary care. Fewer and fewer medical students are choosing primary care residencies or even emergency medicine residencies because they want something that pays more and has more clout. And
Yeah. Well,
so
hopefully we'll shift all of that.
I know. So that's our goal at ViTel Health
Yes.
is
So
happy
let
physicians, healthy patients.
Yes. And I'm a huge, huge fan of independent physicians. So if people are interested in finding out more about your company, how can they find you?
Yeah, so we're at www.vitelhealth.com, VITEL Health. Or you can find me on LinkedIn and send me a DM. I meet with physicians all the time. Probably most of my day is spent in 30-minute meetings with awesome physicians who have lots of questions about starting their own practice. So if you have those kinds of questions, I'm happy to meet with you. My schedule is always open.
All right. Brittany, thank you so much for sharing your story today. I have a feeling there's going to be a lot more to your journey in the years to come, but so far, so good. And I want to just give a big thank you to the listeners for choosing to spend your precious time with us today. And I hope to see you again for the next episode of Reinventing the White Coat.
That's all for this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at shaercoaching.com. Thanks for listening, and don't be afraid to live your best life.